wellness programs that we're beginning to deliver out, those numbers are actually in the 500 to 600 person range right now. The fastest growing segment of the programs that we're delivering today are in what we might think of as the wellness marketplace. Now, the challenge is that that is a different marketplace than what care deliverers like Partners Healthcare normally get involved in. And kind of crossing that chasm and understanding what are the reimbursement models and how does the business work and what are the responsibilities of a care provider versus a wellness organization is a lot of the work that's out ahead of us. So I'll stop right there and kind of turn it back over to you, John. Thank you.
Our next speaker is Harry Wang. Harry is at the Director of Health and Mobile Product Research at Parks Associates. For the last decade, he's been looking at health care industry and consumer health trends in the area. He's been studying U.S. disease management market particularly, and he's a leading analyst for the Parks Digital Health syndicated research program. I've been to a couple of the Parks meetings, and Harry's spoken at a couple of our meetings, and so he's a very well-educated guy on the inside of what's going on, so I'm sure he'll have a lot more to add. Thanks.
Thank you, Jonathan. Finally, a Chinese about U.S. healthcare system. Okay. Just for information, about Parks, I gave a brief background information about our organization and my role at Parks. We are a research company, not as big as Sullivan, but we tend to focus on the personal technology side. And my research in the healthcare space definitely benefit a lot from my colleague research in the home networking, personal technology areas. So it's like in the other industries, healthcare definitely evolved into some of the converged platform, converged communication tools, and that benefit our research tremendously by looking at existing technology, roadmap, and trends in those marketplace. Jonathan mentioned that my roots in the healthcare research starting from late 1990s and early 2000 about disease management, healthcare IT research. And joined Parks in 2005, I started looking at the personal health technologies and feel that similar way as the panelists here and Jonathan mentioned about, it's a very complicated system and involving multiple different type of platforms, different business models, as well as technology usage cases. Just to give you, we were asked to provide an overview of the marketplace. So this is my view or Parks' view about the personal health technology industry. You will notice that all 3 or 4 people on this panel use different terms. For Sullivan use telemedicine, connect health. I use connected care, and Jonathan had definitely have some different type of term using for these technologies. This chart shows us the overview of the personal connected care in ecosystem or the application front. The horizontal row shows the application side of the industry. The vertical row shows the type of, the money flow or, the type of platform we're going to see in this type of industry. So if you look at on the top line there, physical measurement and tracking, and of course you can do it online, you can do it through a corporate wellness program, you can do it through a chronic care disease management program. And on the vertical side, web care, it can be a kind of a web coaching services, can be a tracking of the wellness and fitness data activity on the web, or more advanced, you're tracking the physiological data for patients with chronic conditions. I have a slight different view than Zach in terms of the chart you showed that. You said the fuzzy part is in the middle. I think given all the reform efforts, given all the technology platforms, not only the middle part, even the top part and the bottom part, we're going to see tremendous different new ways of delivering care in the future. And there's a lot of undefined, technology platforms, business models out there, worth our attention to see how this will converge together to change the healthcare space as we know today. We also believe that the wireless technology can have a critical role in the future. Of course, today also play a bigger role in terms of care delivery in the future. These type of applications, we look at the marketplace from a technology perspective, from the PAN to the LAN to the WAN areas and different applications, different services that will drive the industry growth, become a much bigger driver of the personal technology care industry than today. I will stop there, and this is my contact information. Feel free to contact me if you have any questions. Big hands, you know. But I think, you know, we were asked to provide some numbers. I will go on the record saying that, you know, if you look at this personal care technology industry, and looking at the type of solution available, if we're including the purse industry, if we're including those, you know, home diagnostic monitoring device and services, including those, you know, corporate wellness services, I think this industry is already a $1 billion industry. And by 5 years from now, we're going to see the users, you know, the type of revenue-generating users number to top 19 million in the U.S. alone. And I'm emphasizing that it's revenue-generating users, not total users, because I still have a hard time to figure out, for instance, advertising models on the mobile health application side. I still difficult to try to understanding some other aspect of that, where people download free software and you know, how they generate the revenue from that. So that's my 2 cents for now, and I welcome any question from audiences. I hope this is very interesting or interactive dialogue, so we can all learn from each other. Thanks.
Great, thank you. Thanks a lot, and we all kind of agreed that we would kind of keep our comments short, and I think everybody did. Thank you. So that we could get to some of the discussions and questions and answers. To answer the first question we're going to have, yes, all of the slides will be available online, with the exception of mine, of course. But the other ones will all be available online and available at any point. So we can start on the questions, and I have a feeling we're going to kind of go into this. So if you could speak your question fairly loud, and I'll repeat it if need be, and maybe direct it to the specific person.
Easier if I stand. It seems to me that this is the exact nexus between digital health and Silver's Summit. Because it is going to be the self-monitoring, it is going to be all these health connections, no matter how you describe it. The consumer is going to have to know how to use this technology, one way or another. And having seen my 91-year-old mother having her weight monitored, she needed help, and it was a simple process. So what research is being done on your side of the fence to make sure that the consumers can actually use all the great things that have come out of your research?
People hear that? What research is being done to make sure that consumers will actually use all this wonderful technology that's coming down the road and have the competencies to use that?
So I'll jump in.
Why don't you go ahead?
So the Center for Connected Health has the opportunity to run research projects on just this very question. And while in my talk I made a point of saying, gee, it's the same technologies, it's the same infrastructure over and over again, and the differences in the business model, the reality is that when we get down to each one of the programs, we do have to get very particular about what are the technologies we offer out to 40-somethings who are beginning to struggle with an activity and weight kind of challenge versus 70-somethings who are heart failure patients. And it's not just about what is the right and appropriate technology for each individual and for each care paradigm. It's also what is the right technology for each of us as an individual. Thank you. Because in the end, the game is to make sure that we help that person do a better job of taking care of themselves. And in order to do that, they have to get involved and use the technology, and they have to take the coaching as it's going to come to them. So we run research projects around pieces like how are we going to use SMS texting versus email versus kind of a phone coach or whatever to try to tailor it back to make sure that the use of the device and the feedback loops that are involved in helping people do a better job of taking care of themselves are tailored to each individual. And I'll give a quick last example. So a couple years back, we were doing lots of work around heart failure monitoring, and you know, it's pretty expensive to put this equipment in somebody's home. And we immediately, this was 5 or 6 years back, we went to, gee, could we do this with a mobile phone, right? Mobile phones, Bluetooth, the devices are Bluetooth, we can get the data out. But when you really thought about it, the user modality, right, how somebody interacted with that device, we were handing mobile phones to 70-somethings who